A warm welcome to all. As you can read in this video, I am going to clear all the concepts of cardiac cycle. So let's begin. First, we'll see the definition of cardiac cycle. Cardiac cycle includes all the events occurring in heart during one beat. Now, which are the things that occur in the heart during each beat? These are first, conduction of impulse or action potential from SA node to AV node to right and left bundle branch of Purkinje fibers. Second thing which occurs is contraction or systole and relaxation or diastole of right and left atria. Third, the contraction and relaxation, that is systole and diastole of right and left ventricles. Fourth, opening and closing of valves which produce heart sounds. And lastly, the pressure and volume changes occurring during the systole and diastole. If you go through MCQs that has been asked from this topic, that is cardiac cycle, you will find that most of these MCQs have been asked from one of these five headings. So getting into the depth of these five headings is important, and also the sequence of events that occur during the cardiac cycle, that has to be understood as well. Before going into the sequence of events, we'll see what is the duration of cardiac cycle and what is the duration of different phases of cardiac cycle as well. Calculating the duration of cardiac cycle means calculating the duration of one beat. Suppose your heart beats 75 times in 1 minute or 60 seconds. You can easily calculate the duration of one beat just by cross multiplication. So 60 divided by 75 comes out to be 0.8 seconds, which is the normal duration of cardiac cycle. If your heartbeat is 75 times per minute. Now in this zero point 0.8 seconds, atrial systole is of 0.1 seconds, which means right and left atria, they contract for 0.1 seconds. Atrial diastole is of 0.7 seconds, which means right and left atria, they relax for 0.7 seconds. Ventricular systole is of 0.3 seconds and ventricular diastole is of 0.5 seconds. Now the point to note down here is this 0.8 seconds duration is not separate for atrial events and ventricular events. These are intermingled, which means when the atrial systole is going on, ventricles are in relaxation phase, that is diastole. And when ventricular systole is going on, atria are in relaxation phase, that is in diastole. There is a period of 0.4 seconds where atria and ventricle, they both are together in relaxation phase, that is diastole, which is called as joint diastole, and it is about 0.4 seconds. In the photo you can see red line are indicating atrial durations, blue lines are indicating ventricle durations, and the yellow line is indicating joint diastole, that is atrial and ventricular both diastole. When the atrial systole is going on for 0.1 seconds, that time ventricles are in diastole phase, and when ventricle systole is going on for 0.3 seconds, that time atria are in diastole phase. Now we'll see the sequence of events occurring one after the other in the cardiac cycle, which are responsible for pushing up of blood into the aorta from left ventricle and into the pulmonary artery from right ventricle. First, we'll start with the blood coming in right and left atria. The blood coming in right atria from superior and inferior vena cava, which is deoxygenated blood, whereas blood coming in left atria from pulmonary veins is an oxygenated blood. Deoxygenated blood means the blood which is carrying less concentration of oxygen and more concentration of CO2, whereas oxygenated blood is the blood which is carrying more concentration of oxygen and less concentration of CO2. Now, when this atrial filling is going on, after about 0.3 seconds, atrioventricular valves, that is tricuspid and bicuspid valves, they open due to the pressure buildup in both the atria, that is right and left. Opening of atrioventricular valve causes this pressure gradient to push the blood into the right and left ventricles from right and left atria, and this pressure gradient empties about 80% of atrial blood into the ventricles. After 0.4 seconds of opening of atrioventricular valves, SA node, which is a pacemaker, starts generating impulse, which then pass to the right and left atrial muscle and they start contracting. This contraction of right and left atria empties the remaining 20% of atrial blood into the ventricles. Now the next thing which is happening is closing of atrioventricular valve, which happens exactly after 0.1 seconds of impulse generation from SA node and atrial contraction. The cause for closing of atrioventricular valve is buildup of pressure in the ventricles due to the collection of blood, which pushes this valve to close, this causing the first heart sound, which is heard as the word love. Now the next thing which is happening is opening of semilunar valves, and the cause for this opening is same, that is pressure buildup in the ventricles due to the collection of blood. As soon as the semilunar valve opens, the pressure gradient that has created in the ventricular blood causes the blood to be pushed into the aorta from left ventricle and into the pulmonary artery from right ventricle. This pushing of blood is purely because of pressure gradient. There is no role of ventricular muscle contraction yet. After about 0.16 seconds of opening of semilunar valves, ventricular muscle starts contracting as the impulse that has started from SA node to AV node to bundle of His and right and left branches of Purkinje fibers has reached up to the ventricular muscles. Now the contraction of ventricular muscles causes the remaining emptying of blood from the ventricles into the aorta and pulmonary artery. This emptying continues for about 0.14 seconds till there is a closing of semilunar valves. And the cause for closing of semilunar valves is again the pushing of blood in the aorta and pulmonary artery against the semilunar valves. Closing of semilunar valves creates the second heart sound, which is heard with the stethoscope as a word dup. Now we'll see the video showing these events in step-by-step manner. I hope I have helped you with the cardiac cycle topic. Thank you.